Good afternoon, everyone. It's my pleasure to welcome you in this session that, appropriately for the Year of the Youth, will discuss how to best address the needs of young cancer survivors. My name is Barbara Kerstjens, and I'm heading the unit Combating Diseases. But before turning into the discussion, we would like to show you a little video about cancer in general, how it affects us all.
More than ever, cancer is a major and growing societal challenge. Each year, 2.7 million people in the EU are diagnosed with cancer, while 1.3 million die from the disease. It is time to act. The EU is on a mission to enhance, by 2030, the lives of over 3 million people by developing a digital platform on health data for a better understanding of cancer, generating new evidence to help implement effective cancer prevention programs, optimizing diagnostics and treatments through national comprehensive cancer infrastructures, and improving the quality of life of cancer patients and survivors by collecting and analysing data on their needs. The EU mission on cancer is committing €378 million over the first 3 years to tackle this challenge. By working together, we can significantly reduce the devastating impact that cancer has on both individuals and society, whether you are a national or local representative, a researcher, healthcare provider, an investor, a patient, or a caring citizen. Join us and contribute by proposing and implementing activities, projects, or initiatives with and for citizens, now and for future generations.
So you all heard about cancer in general, but this session is about childhood cancer. And why childhood cancer? Did you know that every year more than 35,000 children are diagnosed with cancer in Europe? Did you know that it is the principal cause of death by children above 1 year of age? And we need to do more in the EU to address the needs of the cancer. Why? Because cancer in children is a rare, or sometimes a very rare cancer. And you need to understand that there are important biological differences in the cause of childhood cancer as opposed to cancer in adults. Did you know that by the time of diagnosis, 80% of pediatric cancers have spread already throughout the body, compared to 20% in adults? And more than 30% of the children, the young, affected by cancer, will face long-term consequences. And there are about 500,000 childhood cancer survivors or people with a history of childhood cancer. So before introducing the panel, I want to highlight that this will be an interactive session, and we encourage you to use Slido. This session will address, first of all, what are the needs of childhood cancer, young people with cancer, the survivors, and then second, how can research address these needs? So while you will be listening to our panelists, I suggest you already download Slido, if you haven't done so already, and log on to the RNI Days 22 Session 4. We want to hear your voice. But I spoke about our panelists, and let me first introduce them to you. We have here sitting with me Professor Walter Ricciardi. He is chair of the Mission Board on Cancer and professor in public health. Then we have another Mission Board on Cancer member, Professor Rob Peters, who is the medical director of the Princess Máxima Center of Pediatric Oncology. Then we're very pleased to have on board with us in this session Dr. Carina Ferreira Borges, who is a program manager at WHO Europe. And last but not least, Mr. Thiago Costa, who is a strong patient advocate from the Childhood Cancer International Europe. So you all have heard who are our panelists, and as I mentioned to you, the session has two parts. Let's start with the first one. We will hear from our panelists what they see are urgent needs to be addressed to improve the life of young people that have faced cancer. So, Padre Ricciardi, over to you. 2 minutes. Tell us.
Pediatric cancer has been a priority for the previous board and will be a priority for the next board. Why is that? You mentioned the need to do that and to have a specific attention on this. But to do that, we must have two prerequisites to be successful. First, put the patient and the citizen at the center of the action. We did that in the past. We will be doing that in the future. And second, not work in silos. I mean, the need of pediatric patient and childhood survivors is a specific one, is a composite mix of different needs from the social, the economic, the quality of life point of view. The mission is something more than research. It's a mix of policy, measures, activities. It's also an inspiration to solve the problems. And following the mistakes that are made in the previous mission on cancer, but also in the mission to the moon that inspired the mission. When JFK started the mission to the moon, the first months were terrible because engineers work in silos together with mathematicians. They didn't work together. It was only when there was appointed a program manager in trying to mix this kind of skills and working together that we faced a solution. In the previous board, we made a specific recommendation, and I think it will be of paramount importance to reach the target.
Thank you, Professor Ricciardi. So we heard about the importance of working together. Over to Professor Rob Peters. We will hear a very different view, complementary. Over to you, Professor.
Thank you. In this topic, well, it's important to realize that what you already said in the introduction, that all types of childhood cancer are rare, but together it's the major cause of death. But if you survive cancer, you may have significant long-term toxicities of the treatment or of the tumor itself. And to well address this, we need dedicated long-term surveillance outpatient clinics in dedicated childhood cancer centers, so that this care for our survivors, as we call them, is really up to date and not spread out in very small hospitals. Second thing, what is important is that these, let's say, long-term follow-up, these surveillance outpatient clinics are covered by the insurance, by the health insurance system, and that's not always the case in our countries in Europe. And we need univocal European guidelines for the long-term follow-up so that not everybody is inventing the wheel. And these guidelines should be very personalized, so specific, directed to the type of treatment that children have had received in the past. And for this, it's important to develop what we call outcome indicators. It's not difficult to register survival, but it's very difficult to register the quality of life of survivors. And these indicators of the quality of life should be co-created by the survivors, the parents, and the professionals, both on physical, psychological, and psychosocial aspects. And the knowledge that we have from these data, we should translate these and feedback it to our current protocols to improve the outcome. I think that's the major message I want to give.
Thank you, Professor. Need for long-term surveillance and guidelines, uniform guidelines. So now over to Dr. Ferreira Borges. Over to you, Karina.
Thank you very much. So I would like to focus on two major needs that are important for WHO and that would contribute to improving the life of young cancer survivors. I think the first one was already mentioned in the introduction as well. It's to ensure that people are timely diagnosed and properly treated. This is key, this is fundamental, because we know, as it has been said already in the introduction and by the guests, also my panelists, that cancer survival rates is linked to successful treatment. And of course, successful treatment is linked to being timely diagnosed and having access to proper treatment. So for this to happen, we need highly performance healthcare systems, systems that are capable of supporting and giving the care that is needed in a timely manner, and also to be sure that we have adequate navigation in healthcare subsystems. This looks like a very complicated, adequate navigation, but it's fundamental because many of the people that enter in contact with the healthcare system find it so complicated to navigate that they're not they're not, capable to really reach treatment in a timely manner, as I already mentioned. It is also important to correct information asymmetry. For example, we know that access to information that minimizes the risk of suboptimal treatment is very important, as well as time to initiate the transition process between children's and adult services. These are two main critical points for survival. If we do not access the right time, or if we do not initiate the right transition from children to adult treatment, we know this has an impact also in survival rate. So this is important, and therefore we have been working with governments to be able to look at the pathways, cancer pathways, and also the barriers in access to those treatments so that we can facilitate the navigation in the system. The second point is related to the fact that survivors have greater difficulty in really accessing to affordable care and meeting the high out-of-pocket expenditures that they face. So we know that in many countries, this differential is pushing very many patients and their families also to financial difficulties and bankruptcy. So again, this underscores the need for universal health coverage, very high in the WHO agenda, and also the need for financial risk protection. For many cancer patients and their families, no matter where they live, what countries, this is not just about new terms. This is about a matter of life and death. And we are working hard with our teams, with experts, with governments and partners to be able to address this. One important initiative that I would like to highlight in WHO is the Also Medicine initiative that ensures that we have platforms to discuss innovation in this sector, but at the same time that we discuss options that ensure the sustainability, the transparency, and the solidarity in the access to novel medicines, immunotherapies, and other oncology products that need to be considered for policymakers to ensure better survival rates. Thank you.
Thank you very much. So we heard about the importance of being able to navigate the system and being able to afford the treatments and the follow-up. So then, last one on this panel discussion, Mr. Thiago Costa, over to you.
Thank you very much. So as a survivor, and we know, as you told before, that many survivors of childhood and adolescent cancers are at a higher risk of developing complications on one hand, but on the other hand, we have a lot to offer to society and economy in adulthood if it is provided that appropriate follow-up is in place. So what I would like to highlight is the improvement of long-term follow-up surveillance care, the strengthening of long-term follow-up infrastructures, and the interoperable IT tools, such as, for example, the smart card or the survivorship passport, the organizing transition from the pediatric to adult provision of care as well, the advancing of socio-economical rights of survivors, for example, the law on the right to be forgotten that is already implemented in some EU members, and to ensure better reintegration of childhood and higher cancer survivors into education and to provide them with vocational support. Also to offering education on survivorship for survivors, families, and healthcare professionals, and offering continuous psychological and psychosocial support to survivors and families, and not least to ensure access to fertility preservation and including some funding and expertise on this area, because we think that there is a lack on this, and also the knowledge that is passed to the survivors by the health professionals. And I want to also at last to highlight the importance of the survivors' participation in research projects and the roles, the definition of the roles that they had, that they should have in these projects, and the commitment that they can bring to these projects in order to help the quality of life.
Thank you very much. So we heard a very broad agenda: long-term surveillance, right to be forgotten, and importantly also for us in DG Research and Innovation, involvement of patients in the design and the carrying out of the research. But now I'm turning over to the audience. I hope your Slido is ready. In one word, what do you think the needs are of people, young people surviving cancer. I see already some reaction, the psychological support, the issue of addressing comorbidities, implementation, engaging with citizens, monitoring, mental health, scale up. So the need to do more at a larger scale in more countries and regions. You can also echo what our panelists have put on the table if you think that it is these are important elements that should be supported. So I see long-term follow-up, and this is something that I've already heard from our panelists. Psychological support, indeed. Mental health gets a lot of voices, which is, by the way, a point put on the agenda for our Commission by our President Ursula von der Leyen. And I see a new one, gender specificities. Let's keep that in mind when we address the needs. So I'm waiting for a few seconds more, and then we will wrap this. The right to be forgotten, puts there as well. The transition, I assume this is the transition from being a young person with cancer and going into survivor of cancer. And that is, I think, transition comes up quite a few times. Universal health coverage, this was also already put on the agenda by Carina Ferrero-Borges. Okay, let's close this poll and move to the second part of our session that focuses on, we've heard and we've seen, read the needs identified for people, young people surviving cancer. And now we would like to zoom in on the research. Where should we invest at EU level on research to better address these needs? And we will start by the views of our panelists. So, Professor Ricciardi, what do you think?
Now the challenge is implementation, okay, implementation, because in the previous 3 years we have been working hard in identifying priorities, and also, as the co-panelists said, the most important aspects of taking care of this issue. Now it's implementation. The uncan.eu is an important platform for coordination, not reinventing the wheel, but taking advantages of all the research that has been done and using this as a starting point for future research. As Professor Peter said, we have, of course, something that is relatively rare but becomes an important issue also from a quantitative point of view. But sometimes single member states or single organizations are not able to cover this issue. They are too small, too isolated, too fragmented. And another very important issue is to coordinate this kind of research, making it happening in a way that all patients can benefit of the most important update about research. And last but not least, we are a little bit late in Europe concerning the digital transition. So we are late in comparison with other countries, at least from the technological and interoperability point of view. I think it's an important issue because European Union, but moreover the European region of WHO is one of the most unequal part of the world. Inequity is incredible from this point of view. So the only possibility that we have to reach in some areas, some rural areas, some areas that are far away, particularly now that the war is again on European territory, is via digital. So making something available for patients wherever they live, whenever they have the problem, and not waiting for, moving, travels, hope that can be disappointing.
Thank you very much. So towards implementation and the digital as a way to improve care and research on how to do that. So then I go to Professor Peters. What do you see are the needs that can be addressed through or should be addressed through research?
Yeah, I think that research and care for this topic really go together. So it's not or research or care, it should be both. In this long-term surveillance or long-term follow-up outpatient clinics for childhood cancer survivors, it's very important to have these connected to childhood cancer departments. This doesn't mean that all follow-up should be done by a pediatrician, because after the age of 18, it's better to have this follow-up done by, let's say, internal medicine specialist, but they should be connected to this pediatric oncology center. Otherwise, the data are lost and it will be too fragmented. So this asks also for a more specific type of specialist who does this late effect outpatient clinic. The data that you have there are important for the individual patient to help the individual survivor. But the total amount of data from all these survivors are extremely important to do research on which factors of our therapy are damaging or are giving toxicities, and to adapt this to adapt our current treatment protocols by this. So research is extremely essential and goes together with the care. And one other aspect that I would like to mention, and Carina Borg has also mentioned this, sometimes people say, yeah, okay, survival, that's not so important. We should more focus on quality of survival. Well, you can only focus on quality of survival if you survive. So we need to improve survival, and we need to improve the quality of survival. And you can only do this by research. You can't do this by taking care of individual patients. So you should do both at the same time point. And I think that is extremely important, that you cannot see care and research as loose elements. They're both integrated. And the last thing I want to mention, children are really different than adults, not only in their type of cancer, in their treatment, but also in their long-term toxicities. And this is not only true for physical toxicities or impairments, but also for psychological and psychosocial impairments. And we need to address all of these together with our survivors. They make what is important. We as professionals can't say what is important for the quality of survival. It's the survivors themselves that should make this clear to us.
Thank you. So really research about survival in itself, but then how to have quality survivor and the importance of data and involving the people affected themselves. Over to Carina Borges Ferreira. Ferreira Borges, sorry, Carina.
Thank you. And I will pick up on some of the 2 points also that were already highlighted by Professor Peters. I would like to start by the facilitation, which is extremely important, of prospective long-term follow-up of novel therapies. I would say maybe of some of the therapies that are being used, not just novel, so that we can understand the effects and have appropriate scrutiny on the way that the innovation is being incentivized as well and conducted and paid for, so that we can inform the decision-making processes. I think there's quite a lot to be learned there from this follow-up, long-term follow-up, which is needed. The second one is about performance of the health systems, and again, back to the point where survival is important and the quality of care is extremely important to ensure also all the impact that late diagnosis may have. So it is important to monitor and evaluate the quality of care that is being provided with investments made in robust quality assessment and quality control mechanisms, but also the causes, and I've been talking about this, the causes of late diagnosis for childhood cancer, and investments in measuring the delays between the first symptoms, first contact with the health system, effective diagnosis. All of this is important to be able to improve the quality of care and earlier diagnosis for cancer patients. And then I would come back to the importance of data and how it is important to have, a strong public health cancer surveillance system in place that allows us to both have the data on what is happening, both in terms of incidence and in terms of prevalence and mortality, but also in terms of knowing a little bit more about the long-term sustainability of cohorts that can inform cancer prevention and control. It's also an important investment to be made to make sure that we collect data through these cohorts that can really provide us quite a lot of information throughout the continuum of the cancer pathways. Thank you.
So yes, thank you. Long-term survival surveillance, the need for cohorts and data, but also the need to research to better understand the delay between at the moment of diagnosis. So over to you, Thiago Costa. What are your perspectives? Where should we invest in research?
Yes, first of all, I want to highlight that we may not forget to encourage long-term research on novel agents outcomes, because we know that most systematic treatment agents are old and originally are developed for adults, and only 12 new medicines were developed in the last decade. So it is a really good point that I want to highlight. And then, of course, as other here my colleagues said as well, for survivors, it's very important, first of all, to have updated data in a national way, in the European level, so that we can meet, first of all, where is this population and who is this population and what are the numbers of these young people population, because we know that the number of survivors are increasing. And then we have to think about the right infrastructures also for the survivorship long-term follow-up. And also we have to think about the resources, because not even in many European countries, they have the right resources for having the multidisciplinary teams to do this follow-up care of the childhood cancer survivors. Then I will go by the data to the GDPR. So we know that there are some hurdles with data sharing due to the GDPR in the research. And what we want, and we required an harmonized implementation and interpretation of the GDPR across all EU member states and within some national institutions, because it will be more clarity on the definition, on the legal basis for data sharing in academic research, and also for the public interest. And for the last thing, I would also want again to highlight the importance of having the patient and the public involvement, not only for the survivors, but also for the caregivers. Because, you know, as a childhood cancer survivor, most of the time, the feedback that we listen and the storytelling that we listen is that the first patient advocate is their caregiver. So we need to learn each other's languages to educate and communicate better, and to see how and where should the researchers be involving, and how do patients want to also to be involved, and to incorporate this perspective of exactly those who were affected by the disease. Thank you.
Thank you. So a plea for research in new medicines, but also the infrastructure, the data that allow to ensure good follow-up, and then listen also not only to the patient, but also to the caregiver in terms of what research needs are there out there. So now, after having heard our four panelists, it's over to you, audience. And I see some of you have been already active, but I hope more will be. So where do you think we should be investing in terms of research to improve the quality of life of those young people that have survived cancer? Mental health is shouting at us. Need to do more research on that. The mental health state, I assume, of those that have survived cancer or have a history of cancer. The research in palliatives, which is very different from mental health, but again, the importance of data sharing. I assume that this is also related to the fact that we can make more sense of data if we share them across Europe and across the globe. Research into the impact on families, and this is something that Thiago Costa already mentioned, the importance of not forgetting the caregiver and what the needs are, but also that the caregivers can point to needs for research. Nutrition is coming up as very important. There I could assume, but our panelists can react to that, I could assume that it is what is the type of nutrients that are needed to ensure a good quality of life. Comorbidities comes back again. Indeed, in the longer term, we are all likely to have a few morbidities, diseases together. Digital tools, quality of life, psychosocial support is, and again there. The training of the carers. Okay, this is an interesting element. Caregivers are important, but maybe they need some support, need to improve their know-how. Right to be forgotten comes there as well. The European health data space, as the panelists have mentioned, we need data. It's important to have data also for long-term follow-up. European health data space might be a way to do that. I see pragmatic trials. So that is the type of trials that allow you to compare the advantage of using one medicine versus another. Citizen engagement is there as well. Am I missing? Ooh, quality of life comes up, yes. Indicators, as the panelists have mentioned, it's important to do long-term follow-up, but how do you do that? What do you measure and when? Digital tools, as also Professor Ricciardi mentioned, are important. Sleeping hygiene, if I read it correctly, that's interesting as an element. Integrative oncology, which is also mentioned by our panelists. Yes, please continue. Also to mention to everyone that of course we will keep these Slidos and the inputs you've given us as an audience to guide us, basically, both the board of the Mission on Cancer, but also the colleagues that are dealing with the Beating Cancer Plan, so to guide us in our investments. Polygenic risk score study of Professor Ricciardi. If you see the screen better than I, you you can add to yeah?
Where am I supposed to be?
Genomics as an important element. Okay, I think we'll wrap it up here. So mental health, comorbidities, palliatives, data sharing, indicators, implementation research, impact on families, nutrition, digital tools are those that stand out for you as an audience. So we will now reach slowly but surely the closing part of our session, whereby I will start by asking our panelists for their views on what they've heard from each other and from the audience, and what are our important key messages they would like to address to the Union. And I start again with Professor Walter Ricciardi. Over to you.
I think it's now time for all institutions, so European institution, national institution, regional institution, local institution, to provide concrete answers to the need of the patient and the citizens. So to provide concrete solutions according to their needs. And for doing that, I think that from this panel emerged that already there are something that can be immediately enforced. So there are some information from the organizational point of view, from the psychological point of view, from the technical point of view, can be immediately implemented. And of course, there are other things that have to be researched in the future. And I'm really shocked by the fact that the younger is the age of the patient, the less is an investment in research. I recently am participating in a Lancet commission on neonatology, and shocked, there is nothing for newborns, you know, and there is very few research for children. So we have to insist, and this is the place for European institutions, to fund research where other institutions are not doing that. So enforcing, walking the talk for something that we can already do with the information that we have, and researching the new for giving new results.
Thank you very much. Very clear. Then over to Professor Peters.
Yes, I can only support what Dr. Ricciardi says. And imagine that if you treat a 4-year-old child, and at the age of 4 or 5 is the peak incidence of childhood cancer. But if you treat 4 or 5-year-old child with certain chemotherapy that can damage the heart, that's completely different than if you treat a 60-year-old patient with the same drug. So we need to do research for our own population, our own, I mean, children with cancer, specific for these young children. What we, if I may give an example, we have in the Netherlands, we have merged all our research and care into one national childhood cancer center, which is the Prinses Maxima Center in Utrecht. And one of the key elements of this institute is a long-term follow-up clinic where we see more than 12,000 survivors of childhood cancer. And we learn so much of this by helping them individually, and if they have problems, directing them to the right specialist to treat them in their neighborhood, wherever this is in the Netherlands. But the second thing, to use all these data in a uniform way to adapt the treatment. That can be on cardiomyopathy, so cardiac toxicity, but it can also be on psychological well-being. And we made focus groups for each type of cancer. Focus group are groups that exist of survivors of this specific type of cancer. We did it for all types of cancer and asked them, together with our professional, what the most important indicators for their quality of life was. And that's what we need to do research on, what they feel as important, and we should use the data that we have on those quality of life indicators to adapt our treatment. So which components of our treatment will harm their quality of life that they think are important, and that this is how we should adapt our therapies without losing the cure rate. So that's very important, and therefore also we need to talk with our survivors. What is acceptable, what is not acceptable. So I think that's extremely important to do so. So that's it, actually.
Yes, so investing more also in better understanding the side effects of treatments that are given, and finding new treatments, and then involving the people themselves and their caregivers.
Yeah, and there was one remark from the audience about the genomics. This is also part of our research. We should also look for which genomic determinants are there for late effects, and which children are susceptible for late effects and which children are not. So it's not only the disease, it's not only the side effect, it's also, well, let's say, called the host of the cancer and the toxicity, the person itself.
Yes, so you're referring to the need to better understand the difference between individuals and how they react to treatment, like what is now being done for breast cancer in women. Okay, yes. Thank you.
And not only then for the anti-cancer efficacy of our treatment, but also for the long-term toxicities. These are also depending on our genomic situation, on our genetic profile.
Okay, thank you. Let's switch over to Carina Ferreira-Borges. Over to you.
Thank you. So I would like to highlight two important aspects. First one is related to the investment on making sure that people have the right information, and in particular healthcare providers as well. I mean, we hear quite a lot of cases of young cancer survivors that, that despite of the fact that they had some symptoms, it's difficult for a healthcare provider to believe that this can happen at a very early age. So it would be good to use some of behavioral and cultural insights to understand also, why is it that from a healthcare perspective and a healthcare provider's perspective, this kind of concept that someone can have cancer, from a very early age, and the importance of looking at some of the signs as well that can elicit some of, adequate diagnosis would be very important. So investing for sure in information, in training, so that healthcare providers understand that this can start at a very early age. Then the second thing is about meaningful engagement of both people living with cancer, young cancer survivors, but also meaningful involvement of youth networks. We need to create, for the prevention side, networks that are able to support enabling environments that contributes to cancer incidence. We didn't talk a lot about prevention here, but I would like to leave this in my concluding statements, that this is extremely important as well. And we need to make sure that we have those enabling environments that have also an impact in the development of cancers. For childhood cancers, this is not so important, but the involvement of youth is extremely important for the continuation and for the long-term perspectives in terms of the youth cancer survivors, and on the needs, the psychosocial needs, the environments to be able to have, more protective also policies in place. So I would say that psychosocial support is also a major need, and it's also part of those enabling environments that we need to have in place. Thank you.
Yes, so a new element on the table, the enabling environment for the young and the survivors, which is also peer-to-peer networks maybe and supportive networks from the caregivers. Okay, so now Thiago Costa, over to you. What are some of your concluding remarks?
So I think we need to engage more with survivors in these research projects. Not only the survivors, but also patient organizations and the youth networks that have been done some already proven projects and proven outcomes in European projects before. So you can count on us, and also not looking also for the long-term follow-up, but also for the socio-economic rights of the survivors. And for finalizing, I want to say that the European Childhood Cancer Community and CCI Europe heartily welcome the Commission's dedication to childhood cancer, including the organization of the upcoming Conference on Young Cancer Survivors, and that our society stands ready to contribute to future important initiatives. And we look forward to supporting the Commission and its endeavors to improve the reality of childhood, adolescent, and young adult cancer survivors. Thank you.
Thank you. Yes, important. I will say a few words more about the conference in the closing remarks. We have about 3 minutes left, and I just wanted to ask our panelists, have they anything to say about inequalities in relation to childhood cancer survivorship? Someone wants to take the floor? Yeah.
Reducing inequalities is a key challenge for Europe, for all over the world. Unfortunately, inequalities are increasing. The world is in turmoil. We have 5 crises in the same time: the pandemic, the war in Europe, the inflation, the energy crisis, and this is going to increase. So from our point of view, we have to work even harder than in the past. Where inequalities already happen, they are increasing, and we have to tackle them seriously.
Yeah. Someone else wants to take the floor from the panelists? Not particularly, just yes, Carina?
No, there's...
Yes.
No, sorry.
Thank you. No, just we have been seeing this rise in inequalities, and the WHO is very much worried with this. As I mentioned, access to treatment and affordable medicines, especially for cancer treatment, is a key element for in the discourse of in the agenda of the young cancer survival aspect. So it is definitely something that needs to be taken into account. Again, the fact that these in information are very important and lead people to further inequalities. Thank you.
So I will take the floor. I know that you would like to come in, but we have 1.5 minutes left. I would try to summarize the key messages that came out of our discussions. I think it is not forgetting the caregivers in their role in survivorship, having this long-term perspective on survival, long-term follow-up, for which we need to have the digital tools available and the infrastructures. We need to involve the cancer patient themselves when they are cancer patients, but after that as well for the research. We need to address inequality collectively. Like Walter has been saying, there are things that we can do now, and we should implement what we can implement. But there are indeed a lot of things that need to be researched on. For example, in terms of new treatments that have less side effects. And as we all realized in this conversation, is that mental health is an issue not to be forgotten, that needs to be addressed both in implementation and in research. And right to be forgotten is something that maybe within DG Research and Innovation is not on the agenda, but I heard that message coming out of you here in the panel and at home. And the conference next year on how to address the needs for cancer patient survivors or young people with a history of cancer. Looking forward to meet you all next year. Date to be confirmed. Thank you very much, everyone. our esteemed panelists, and hope to see you next year.